Some people see a deterioration of our eyesight as simply a sign of aging, but conditions like cataracts aren't inevitable, and in fact there are things that you can do to lower your risk. So I have some experts here to help. We have Dr. Ashley Sanfilippo, Dr. Louise Doyle, and Dr. Heather Kelling, all with MD Ohio, or Mid-Ohio Eye, I should say. So welcome, ladies.
Thanks. Thank you.
So Dr. Kelling, we'll start with you, the basics. What is a cataract?
So some people have a misconception that cataract is a film over the surface of the eye, and in actuality it's a clouding of the natural lens inside the eye. And as that clouding develops, light entering the eye can't be focused precisely to the back of the eye, so it tends to get scattered, or some light rays don't even get in the eye at all. And that's where the vision problems come in. And that clouding develops because proteins inside the lens are becoming denatured or broken down.
Okay, so do we know what exactly causes that? Aside from that, are there specific conditions that are going to cause cataracts?
Well, a big risk factor is age, and 50% of 65-year-old Americans have some degree of cataract formation. Diabetes is a risk factor, radiation exposure, prolonged exposure to ultraviolet light, steroid use, whether that's steroid pills or IV steroids, can be a risk. Trauma to the eyes, smoking, and there's some inherited forms of cataract that can be passed from one generation to the next.
So there's plenty of reasons that you can get cataract, and how do we know if we have one?
Well, early on, cataracts may not have any symptoms, but as cataracts develop, patients will definitely start complaining about cloudy or blurry vision. Bright lights may cause more glare or light sensitivity than they used to. Patients will see halos around lights. Headlights at night will have that starbursting effect. Night vision in general becomes more difficult. Colors become dulled. Some patients have double vision in an eye with cataract. And it's not uncommon for patients to see frequent changes in their glasses and contact lens prescriptions as the cataracts are developing.
All right, so enough signs that you should know maybe if something's wrong as it progresses. So Dr. Sanfilippo, you're a glaucoma specialist. You're also a cataract surgeon. So what is involved if somebody comes in and they're having an evaluation? What do they go through at that point?
Well, the only way you're really going to know if you have a cataract that's ready for surgery is to come in to see your ophthalmologist and have a comprehensive dilated eye exam. This is not only going to assess the cataract for you, but it's also going to show you what's going on with the overall health of your eyes. Sometimes we detect conditions such as dry eyes, macular degeneration, diabetic eye changes, and even glaucoma that can sometimes coincide with cataracts, and these may need to be addressed or treated in conjunction with the cataract surgery. But if you're deemed to be a good candidate for cataract surgery, we do take measurements of the eye that help us choose an intraocular lens implant that will be placed at the time of surgery. And those lens implants come in various shapes and sizes, so this is meant to be just for you. It's personalized just for you. We also do pretty extensive interview of your lifestyle, your hobbies, the activities that you like to do, and your goals of surgery, and this helps us select a lens implant. You know, we want to know, do you do a lot of nighttime driving? Do you do a lot of reading? Do you spend a lot of time on the computer? Do you have any sports or leisure activities that you like to do? Are you a golfer? You know, we of course hope we can help your golf game, but we don't know that we can do that. But you might
can't help the swing maybe, but you can help them see.
Yeah, see the golf ball a little bit better when you're looking for it out in the rough. So.
Gotcha.
But, yeah, so we have a lot of things that go into that cataract evaluation.
So you go through this evaluation, you talk about the lens, there's options for people. So what exactly can somebody get as far as the lens options?
So there is a standard lens implant that we use for cataract surgery, and in general this is a great lens implant. It uses the most, you know, technology that we can offer for a lens implant, but it has its limitations, and most individuals end up having, you know, great vision for distance, but oftentimes still need glasses for reading, for using the computer. So if there are individuals who desire more freedom from glasses and contacts after cataract surgery, we do have specialty premium lens implants that are available for those people. And these include a toric lens implant. Toric lens implants can help correct significant astigmatism, accommodative and multifocal lens implants, which can help individuals see more near and intermediate distance as well as that far off distance vision. And in the end, it's a personal choice with the patient that we kind of help direct them with
in
their
the
lifestyle.
right direction.
Yeah.
Okay, Dr. Doyle, let's get to you some stats involving cataract surgery because it is very common.
Yeah, yes, it is. Cataract surgery is the most common surgical procedure. Nearly 3 million Americans will have surgery this year. Thankfully, it's also one of the most successful procedures. The American Academy of Ophthalmology reports 99.5% of the patients will not experience a severe complication.
And they find out pretty quickly the success they've had, right?
They do, yes. Why don't I tell you a little bit about the experience of cataract surgery?
Well, I'd love to. We're running out of time, unfortunately.
Oh, okay.
Which is fine, but that's what I was saying. But it's a quick
very
procedure,
yes,
right?
it is, and they know their outcomes quite quickly. Usually, about at a month, they'll know what to expect.
Okay,
yes.
Perfect, ladies. I want to thank you so much for the education today. If people want an evaluation, we have your office phone number and website on screen. So thank you.
Great,
All
thank
right,
you.
great. Thanks.